Clinical pharmacists never regret their career choices, right? Well, what if I told you that 50 to 70% of clinical pharmacists are experiencing burnout and work exhaustion? This is an important fact to consider if you are looking into neurology pharmacy. Hi there, I'm Alex Barker. I'm the founder of the Happy PharmD, where we are dedicated to helping pharmacists discover and get into careers they love through our coach program. In this video, we will be uncovering neurology pharmacists' pay, their job satisfaction, whether they're in demand, and the flexibility of the role. Let's get to it. So what does neurology pharmacy do? Well, they deal with any neurological problems. And it's more specifically geared towards things like epilepsy, migraines, seizures, and it's not so much psychiatry pharmacy, which is more about mental health, depression, anxiety, schizophrenia, those kinds of disorders. They're often practicing in places like health systems and primary care clinics, and usually it's within a giant health system integrating the two. I only found around 134 pharmacists with neurology and pharmacist as a part of their job title. There is no board certification for this niche, but many neurology pharmacists do get a certification as a BCPS or a BCACP. We only found one neurology pharmacy program that may grow in the future, but like one program, and there are thousands of PGY1s and definitely hundreds of PGY2s in many different niches. Typical job titles for this include neurology or neuropharmacist, clinical neurology pharmacist, or neurology clinical pharmacy specialist. Let's talk about what you can earn as a neurology pharmacist. Well, we checked out ZipRecruiter and they said that the average annual salary was $129,000. Of course, the normal factors play a role here: education, certifications, previous experience or skills. But most importantly, it is honestly, in my opinion, it's based upon where is the job. If it's in California, you should expect a much higher base pay because of the higher cost of living versus somewhere like my Iowa corn brothers and sisters, okay? You're gonna probably get lower paid. And it's not because of the corn. Stop blaming the corn, okay, for your salary. We found one job in North Carolina where it was with the government and it was at a healthy $135,000. We found another job in a private sector and it was a range between 114 to 137. Occasionally these jobs do have some bonuses, which we'll talk about here in a little bit in job demand, but it's important to note that these salaries stink in comparison to non-residency trained jobs. I mean, you can get paid almost the same amount, if not way more, in a community pharmacy role. No residency required. That it frustrates me. And I'll talk about that in another video as to why that is. But ultimately, for the extra training that you'll probably do for this role, it's unlikely that you will get paid more than pharmacists who do less clinical heavy, intervention heavy roles. For that added responsibility and for the fact that it's not that great pay, in my opinion, for the extra work, I'm going to give the salary score a 5 out of 10. If your brain is firing on all cylinders and you're enjoying this video, we would love it if you would hit that subscribe button and like it as well. So if the salary is meh, are these pharmacists happy? Let's talk about job satisfaction. Unfortunately, there is not a lot of published research on the topic of neurology pharmacists. What we do know is that neurology fits within clinical pharmacy at large. And from the majority of studies that are published out right now, over half of pharmacists are burned out in a clinical pharmacy practice setting. These pharmacists often talk about poor work-life balance, high patient volume and expectations of workload, and emotional exhaustion. One study reports that 47 to 70% of clinical pharmacists are suffering from burnout and work exhaustion. But what we also know from the literature is that clinical pharmacy specialists tend to have a high level of fulfillment and satisfaction with the work. When they're solving problems, when they're helping patients, this is where people's satisfaction comes from. It's unfortunate that it's the work environment that is causing so much stress on pharmacists. We did find one Q&A with a neurology resident who talked about a high level of service being demanded of them, yet rich with opportunity. This pharmacist said, quote, "In short, you never go home unfulfilled from your workday." Reading her story definitely was a very biased approach. It's highly unlikely that you're going to hear a resident talking about on Pharmacy Times any of the negatives of her or his experience. Typically, these sort of things are published to talk about the profession, introduce new eyeballs on it, get more interest, and talk about the positive of it. So take it with a grain of salt. So while I think these roles will cause people to feel fulfilled by the work involved with it, I think most of these environments, you will find most people eventually have some sort of burnout. It may not be full-fledged, and burnout is kind of like a spectrum, right? It's not just if you have it or you don't. Burnout is insidious. You don't expect it. It happens in stages, and it gets worse and worse over time. And by the time it gets so bad, it may feel like you can't fix the situation. So in general, for satisfaction scores, I'm going to say that clinical pharmacists have a high likelihood of suffering from burnout. I'm going to say that the work itself in the right environment has a high potential to be very fulfilling, as you'll be problem solving lots of patient problems. So for these reasons, I'm going to give satisfaction score a 6 out of 10. Let's talk about the job market demand for neurology pharmacists. Are there so many jobs that you don't know which one to pick, or is there not a lot of selection? Well, according to Indeed, we found about 240 jobs. The majority, 74% of these jobs, were entry-level positions. This entry-level rate is a little bit lower than what we've seen in other niches. Usually you could expect about 90% of jobs available are fine with entry-level. Meanwhile, on ZipRecruiter, we found a little bit more. Around 330 jobs were open. Those jobs on ZipRecruiter were specifically for salaries over $120,000. It should be noted that these job postings search algorithms are not that great, as they often include other positions like nurses or physicians. So take the number here with a grain of salt, because when we looked on LinkedIn, we only found 6 jobs available. I don't take that to mean that there's only 6 neurology pharmacist jobs available. It's just what LinkedIn found, because not every job wants their posting to go through the LinkedIn algorithm. We do know that there's not a lot of people in this field, and so I wasn't surprised to see that a few jobs we found had bonuses available. One job in California had a $15K sign-on bonus. Very nice, I like that. And in Oakland, there was a $5K sign-on bonus with relocation assistance. This is nowhere near what community pharmacy bonuses are at. We're talking 15, 20, 25, even up to 50K, depending on the location. But it's still nice to know. It means they're in demand. And one factor to take note here about the job demand is the future of this profession. We know that there are billions of people with neurological disorders, and the population is only getting bigger. So I do speculate that there will be a growing demand here, but this profession is like at the infancy of its life. If you compare this to like ambulatory care or even just clinical pharmacy within hospitals, it's a baby, because the literature is often focused on interventions, the value of what we can do as pharmacists in neurology. Like compared to AmCare or internal medicine, we're talking its infancy, because there's not a lot of studies being published and the interventions aren't all that compelling right now. So a lot of literature needs to build up in order for hospitals to see this as very valuable and cost savings or revenue driving, in order for them to invest having a neurology pharmacist. So to wrap all of this up, there isn't a whole lot of entry-level jobs. There's not a lot of jobs in general, but you're not gonna have a whole lot of competition if you get into this field. Most of the jobs are in metropolitan areas, and the profession itself hasn't yet to prove itself. There aren't thousands of jobs available. but you could speculate that maybe there are more growth trends going to happen. For these reasons, I'm going to give the job demand score, its worst score out of the bunch, a 4 out of 10. So let's talk about my favorite factor, flexibility. It's the magic factor, okay? Is it a good schedule? Is remote possible? Is it easy to get into or out of or transition into something entirely new? And is there a good work-life balance? Well, we do know some data, and we know that neurology pharmacists typically can have a good schedule. Like this job here at the VA where they reported a 8 to 5 p.m. job. If you are working within the hospital setting, I would imagine that there is a possibility to being on call or having a wonky schedule, maybe working in a weekend here or there. But if it more so is in a primary care clinic, I would guess it's 9 to 5. There is a possibility for remote or hybrid roles, as we did found a few of those in our job search, which is nice. I'm always a fan of that. And we may see more of that growing in the future as telehealth is getting more and more accepted in the marketplace. So how easy is it to get started? Well, if you're a clinical pharmacist or you have that experience or maybe a residency, the neurology pharmacist jobs that I found, only 3 out of 6 of them required a residency, and they weren't specific to a PGY2 neurology residency. But some of them did require things like a board certification in AmCare or BCPS, and others just wanted years of experience. In our coaching program, we help pharmacists position themselves to show employers that they have the experience necessary to do a job. So I don't really see this as a roadblock, but I do want to present to you the hard data of hey, only half of them that we looked at required a residency. I think some of the perks of this job is that there is probably a decent level of work-life balance, but it is highly environment dependent. I think if you can get a great schedule and a great team to support you, great boss, then you're probably going to have a great balance. Whereas if those things are absent, then you may be looking somewhere else for another job. I think that this field is somewhat easy for people to go in and out of. I don't think you need a PGY2 to get into this right now. I think that you can gain experience in whatever hospital or health system you're working in, and then start, seeing if you like this field, practicing there, getting experience, maybe even shadowing someone who has that experience and could teach you how to do that. I think this field also makes it possible to go into other fields totally unrelated: academia, research, clinical operations, heck, even pharma. Let's break it down and give flexibility a score. Well, because of the fact that these can be remote, hybrid roles, they often are 9 to 5, but not always, and that the career path is very flexible. If you don't like clinical practice, you can go into other things. You can go into all these other career paths that we talked about. I'd love to give the flexibility score an 8 out of 10. Its best score out of the bunch. And now for the final rating. So before I share my final result, I'd love to hear from you. Was I too harsh on this career path? Did I not provide enough information? I'd love to hear what you think is missing. So for salary, I gave it a 5 out of 10 because you're not going to be paid more than your community or hospital staff, brothers and sisters. For all that extra training, that stinks. For satisfaction, I gave it a 6 out of 10 because while the work is probably very fulfilling for the right person, the environments in general are very likely to cause burnout. For job demand, I gave it a 4 out of 10 because there's just not a lot of jobs available in this sector. There's potential for it to grow, but that may not be the case. It's still kind of its, infancy stage, trying to prove itself. And for flexibility, I gave it its best score of an 8 out of 10 because of its remote capability, because of Friday schedule, which is very nice, and its flexibility to get in and out of this field. So if you can do math really quickly, you already know this. We gave this career path a final score of a 6 out of 10. If you'd like to learn more about this career path or other pharmacy career paths, please check out our other videos that we produce here every week about pharmacy careers, or join our community. This is a free community that we host, and it's filled with other pharmacists who are on the same journey as you, looking for career paths that they're interested in, networking with each other to help one another and introduce new jobs and opportunities with fulfillment and satisfaction, jobs that actually make people happy in this profession. We'd love for you to be a part of it and experience a different way of thinking about your career and what you have the potential to do. Thank you so much for watching this video. If you liked it, please hit that thumbs up button. If you disliked it, hit that thumbs down and let us know what we can do differently to improve in our next video. Thanks for watching, and until I see you in the next one, take care.